Cleveland Medical Hackathon gathered together developers, designers, engineers, entrepreneurs, along with doctors, nurses, statisticians, data scientists. It's really just this amazing collection of experts in their field. And that group pitched ideas, challenges, pain points, whatever they felt passionate about in the realm of healthcare and medicine. And then they formed teams around those ideas, and they worked together for a full 24 hours to brainstorm, code, and basically build solutions. And at the end of the day, we had 21 different projects that were apps, medical devices, and some were just new processes or new ways of doing things. If you've never been to a hackathon, it's this amazing experience where people are working together in a very intense way over a relatively short period of time. And the amount of passion and commitment to solving problems is just incredible. So you couple that intensity with the world of medicine and healthcare, and you really get a wow experience of people kind of challenging one another, saying, have you tried this before? Well, yeah, we've tried that before. Would this work? No, I don't think that would work. Let's take a different route. Let's use this tool over here and build something that truly has impact. Not just a good idea, but a real solution. And it's validated by real experts in the room. And the innovation that comes out of that intense, challenging period of work is amazing.
Which kind of brings us to your challenge. The Hackathon Challenge is all about personalized care, looking at distributed care, and obviously at collaborative care. How can we use the big data that's out there today, collect it, and improve the workflows, improve the care models, improve the outcomes, and obviously lower costs in healthcare? Most importantly, improve the experiences for both the clinical teams and the patients as they go through the healthcare system.
You are my shining hope. Tomorrow morning, I'm hopeful to say, Northeast Ohio, this collaboration between unbelievably smart entrepreneur-like spirit, great technology vendors, and clinicians. Imagine what we can do. Imagine if we can be the Silicon Valley of healthcare right here in Northeast Ohio.
But it's much more than people. It's ideas. It's the opportunity to collaborate. It's the opportunity to discover. And then to innovate and have that do, as Brian said, benefit patients. So what you're doing today is discovering, but what you're doing today is benefiting a patient, their family, and the community by the work you're doing. And we pass on our deep appreciation. You symbolize and embody what the Global Center is meant to be and what it will be. A place for learning, a place for collaboration, and a place for discovery. Thank you for being here in this setting, and thanks for the talents that you've given to each other, and then ultimately to patients from your work. Thank you very much. Have a great day.
Nesco Resource is a national recruiting and staffing firm headquartered in Cleveland, and it's been around since the 1950s and has always had a focus on engineering and technology. And when you look at a hackathon, these events are really about connecting people's expertise with challenges on the table, and it's about providing a platform for those people to utilize their talents and come up with solutions. And that's really what Nesco Resource does on a daily basis all across the country. So we were not only the presenting sponsor of this event, we were also a producer and got very hands-on with it because it is so closely related to what we do and who we are.
Guardian Angel. Today we're going to help you turn your smartphone into your own guardian angel. So the problem that we're trying to tackle is the patient safety application. So primarily we're trying to deal with injuries or causes of death from falls.
Allows you to put in the medication you need to take daily, and it suggests trackers that you might want to keep up with. Here he has steps he wants to take.
See, this is actual real-time data. We're using the yellow line there. Is the yellow line on this one? Yeah. Perfect. Okay, the yellow line is the blood sugar. We're using Validic data.
We have 1,200 point sources that we visit annually. Right now it's done on paper. It's inefficient. We actually have duplicate data entry, and this is what I pitched to the team.
Ohio's IMR is 45th in the country at 7.33. That's 21% above the national average of about 6. And Ohio's IMR among African Americans is 50th in the nation.
We think we can impact quite a bit of patients here. We did some research and said 2 out of the top 5 most prescribed drugs are blood pressure medications. And about 15% of Americans are patients. That's about 45 million people. So if we could strap some type of wearable that monitors blood pressure in a
So there were definitely winners at the event and projects that wowed the judges. But when you look at the real results, it was ultimately about the connections that were created. You had people from across disciplines and institutions working together on projects that they were truly passionate about. And they were about making people's lives better. And whether you're talking about safety or security or public wellness or just making people healthier, that's really huge. And I think that the connections created at the event will strengthen and remain over a very long period of time.